Alright guys, just a reminder, this is not official medical advice or such. Please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers. I'm coming to you with a weekly podcast of the Common Sense MD. Today I'm going to talk about a very important subject called anxiety. I think it needs to be addressed because it's so common, it's getting worse in our world. And I see patients every day that come in for illnesses that I know anxiety is playing a part in, if not causing the whole thing. It may be the cause of their real illness. I see that a lot. You need to recognize it. And yourself and your doctor certainly needs to recognize it's playing a part and be honest about it. We're seeing it, a ton of it. We're seeing it a lot in kids. It's just no wonder with the world we live in now. It's stressful. There's toxic foods. There's, all the processed things we eat, the air we breathe, the social media is toxic. It creates anxiety. Way more than it used to. There's no doubt about it. I mean, look how many kids in schools are classified as having stress disorders. I think half of them are. Back when I grew up, you never saw that. So it is a stressful world. I'm seeing it all the time. It causes real illness, and we need to recognize it and deal with it. But there is hope as long as you recognize it and try to get to the bottom of it, because it usually has reasons. Now, what is anxiety in the first place? I would call it fear or worry. I think it's the same thing, fear or worry. As my friend Jamie Winship told me years ago, people are born with only two fears, fear of heights and fear of loud noises. And that really surprised me that it's true. All the other fears are learned behaviors. Some fears are helpful. Most fears, of course, are not helpful to you. They're not warranted. Who was it that said the only thing to fear is fear itself? I think that was my mom. But in any event, the Bible says fear not about 16 times. So is it a lack of faith? Maybe. I want to focus on anxiety, which I equate more with persistent worrying. I see a lot of people like this all the time. And I consider it a toxin. I think stress is a toxin. It causes real disease for sure. Heart disease, autoimmune diseases, GI problems, which is really the start of many problems, digestive illnesses. Remember that gut-brain connection by the vagus nerve. It's so important. Well, the vagus nerve is a cranial nerve, meaning it starts in the brain. It is connected to other parts of your body besides your gut. It's connected to your heart, your lungs. And when you activate this vagus nerve, it turns on the parasympathetic nervous system, which helps you feel calmer, reduces anxiety, helps you digest your food, and it also decreases pain tremendously. Breathing exercises, meditation, massage, even stimulating your brain with mild electrical impulses. You should see my podcast I did with Christy Schultz. Very helpful. Send a lot of people to her for this. And of course, there are medications that in some people are really necessary in more severe cases, of course. But they don't address the root cause of the problem. And that's what I want to try to get into when I suspect that anxiety is the cause of their medical problems. It takes a little time. But I always ask them if they think anxiety or stress could be causing their symptoms. I'm honest with them. Could this be causing your symptoms? Symptoms are people usually go to the doctor because they're tired or they hurt. That's the most common reason they come to the doctor. So if the patient admits anxiety, or if, in my opinion, I think they have anxiety, I always ask them what are they worried about really? And if they think about that, it stimulates kind of a thought process that really gets them on the road to recovery, I think. What are you worried about? Sometimes they can identify the source, and we can talk about it. Something that's much deeper, like childhood trauma, that's common, abuse, poor self-image. These are not easy, but with the help of well-trained specialists, they can be helped. For other mild cases, sometimes we can get the patient to realize it's anxiety, and to start dealing with it, thinking about it. And some common sense ways, common sense reasoning really helps them. A lot of people don't realize that's the cause of a lot of their problems. I see a lot of patients in my practice that spend so much time and expense searching for obscure answers to their not so obvious infirmities, that their whole life becomes obsessed with this. For some of them, it may be secondary gain, where they have something that they're gaining from it. And it's almost intentional in those cases, in order to maybe gain empathy, financial gain, excuse not to work or live a normal life. Munchausen syndrome comes to mind. That's a totally factitious disorder. I've seen cases of this, but it's rare. Munchausen's by proxy is where they project it onto their own kids. I've seen that a couple times too. But that's rare, and I'm digressing. So what I'll do about patients that I think have anxiety as their main problem. The first time, again, is getting them to realize it. But first, I do rule out other causes of it, like a very bad diet, hormonal imbalances, thyroid disorders, mineral and vitamin deficiencies, sleep disorders, ADHD. A lot of times, those anxious people really have ADHD. Treat a lot of adult ADHD. Adrenal problems. So you have to really, get to the root of the problem. You don't rule out anything that's really what I call medical, not psychological, but it's all medical. The psychological is just as important as what's going on pathologically. So, after I get to know a patient really well, a lot of times I can ask them about their life and what they're so worried about. Sometimes I'll just tell a patient, hey, life is short. We're all going to die. Why aren't you spending all your time obsessing about this and not just live out your life and enjoy while you're here? Sometimes that approach helps. Sometimes it's like talking to a brick wall. So you have to take time with these patients. You just don't want to slap them on a medication. But sometimes medications are needed along with psychotherapy. I always start out in mild cases with the herbals that I like saffron, L-theanine, ashwagandha, rhodiola, ginseng. I always try to teach them how to breathe. I'll send them to classes on this. Look at my podcast with Zach Kramer. It's great on breathing. This whole job is to help people breathe better. And you can really breathe away a panic attack or stress. So it's amazing how it works. There's so many medications out there for anxiety and the depression, which usually follows anxiety, and also bipolar illnesses. And there's lots of antipsychotics. There's lots of schizophrenia out there. In my opinion, bipolar patients and schizophrenia, they need to see a psychiatrist. But for anxiety and depression, a lot of times it falls to the family doctor to do it. We see so much of this. And I found, it can be very rewarding to treat people for this. A lot of doctors totally want to send them off or just tell them it's in their head. Well, it may be in their head, but it's a real thing. So, it requires some time to really get to the root cause of the problem. And that's one thing I like to do. And I have a lot of ancillary services I can send them to as well. But you have to have patience and incorporate other modalities as well. With anxiety medicines, you have to consider addictions, tolerance, and abuse because it's out there. That's why so many primary care providers don't want to deal with it. I mean, I've had patients that, are 70-year-old ladies that have been on a little bit of Xanax every night just to help them calm down. They get a new provider who cuts it out because they don't want to ever prescribe the drug Xanax. Some people need it. Some people really need this. So you have to fill it out whether you think they're an abuser or not, but some things are pretty obvious, and some people pretty obviously need it. And again, I have other people who refuse to take anything like this when it could help them so much. I've seen that about as much, to be honest with you. But of course, these medicines can be addictive and very abusive, so you have to know what you're doing. A lot of times we'll incorporate a therapist to go along with what we do. Empathy carries a lot of weight with me. Because really, you don't know, you haven't walked in their shoes. You don't know what they've been going through. And some people don't want to talk about it. So some of you just have to intuitively recognize and be empathetic, and you treat it. If they're not exercising daily or getting sleep, or they can't get away from abusive relationships or terrible jobs, it's hard to help them. I've always said that wearing yourself out physically with exercise and trying to focus on helping someone else with their problems instead of your own are the best ways to deal with anxiety and depression, because they go hand in hand. So be aware that anxiety, i.e. worry, could be controlling your life. So you need to seek help for this. There's hope for it, and there's great treatments. So if you think it may be causing a lot of problems in your life, it certainly can, then seek help for that and be honest about it. There's nothing to be ashamed about with anxiety or depression. So I hope this helps. Hope it's the first step for a lot of people. Share it with your friends. And if you have a problem, come in and see us at Performance Medicine. Thanks. I'll see you next week.